Welcome to the deep dive. Today we're looking at three really significant pieces.
That's right.
First up, something from the editorial section on India's economic inequality might challenge some common ideas.
Uh-huh.
Then also from the editorial pages, a really critical discussion on pilot mental health.
A very important, often overlooked topic.
And finally, from Ground Zero, a heartbreaking report on a bridge collapse in Gujarat and the questions it raises.
Yeah, a tragic situation there.
Okay, let's start with India. So this recent World Bank report, it's got some pretty eye-opening claims, right? Suggesting extreme poverty is almost gone and consumption inequality has fallen dramatically since, what, 2011-12?
Exactly, and it definitely pushes against a lot of the narratives we often hear.
It really does. So what's the basis for these claims?
Well, what's compelling here is that these bold findings, they're rooted in official survey data. Specifically, India's Household Consumption Expenditure Survey, the HCES, for 2022-2023. And they use something called the Modified Mixed Reference Period Method, or MMRP. The source describes it as an improvement aligning with international best practices for capturing spending more accurately.
Right, MMRP. Got it. And this showed inequality dropping.
Significantly.
Yeah.
The consumption-based Gini coefficient, that's the standard measure, lower means less inequality. It fell from 28.8 to 25.5 between 2011-12 and 2022-23.
25.5. That sounds like a big shift.
It is. Now, there's critique, and it's fair, that these surveys struggle to capture, the spending of the super rich.
Right, that makes sense.
But that's a limitation of pretty much all survey data everywhere in the world. It doesn't invalidate the trend for the vast majority. The source argues that for the 95% of the population the survey does cover, this decrease in consumption inequality is, quote, substantial and indisputable.
Indisputable for the 95%. Okay. And what does that actually look like in people's lives? Did the data show specific changes?
It did, and this is where it gets really interesting, I think. We're seeing tangible improvements in what people are consuming. Like what?
Like per capita milk availability, up 45% between 2012 and 2023. Eggs are up 63%. More fruits, vegetables, protein products overall.
Wow.
And significantly, the share of spending on basic cereals has gone down, while these healthier items have increased across all income levels. But the improvement is actually most striking for the bottom 20% of households.
So the poorest families are seeing the biggest dietary shifts.
That's what the data suggests, yeah, both rural and urban. And this ties into the poverty figures. The source says this consumption data irrefutably shows extreme poverty is nearly eradicated.
Eradicate, that's a strong word.
Well, almost eradicated. Based on the $3 international poverty line, the estimate is around 27 crore people. It's 270 million pulled out of extreme poverty between 2011 and 2023.
270 million, that's a staggering number. Is there anything else backing this up beyond the consumption survey? What about income inequality? We hear so much about that. Good question. Yes, there's other supporting data. For instance, nightlight data. Using satellite images of lights at night shows big increases in proper Pakka homes and paved roads in rural areas over the last decade. This is linked to government schemes like Pradhan Mantri Gramin Awas Yojana and Gram Sadak Yojana.
Okay, so infrastructure improvements visible from space.
Right. And get this. Among the poorest 20% of households, over 40% own some kind of vehicle today. Back in 2011-12, that figure was just 6%.
40% is a huge jump in asset ownership for the lowest group.
It really is. Now, on income inequality, the picture gets a bit more complex. Those World Inequality Lab estimates, the WIL data that often get cited showing very high inequality, the source argues they have limitations.
Such as?
Like, assuming consumption is higher than income for maybe 70–80% of households, which seems unrealistic, this potentially underestimates income for the bottom 80% and overestimates it for the top groups. But even if you take the WIL data as is, it actually shows the income share of the bottom 50% increased slightly between 2017 and 2022, while the share of the top 10% decreased slightly.
Oh, that's interesting. I haven't heard that highlighted much.
Right. And then you have to factor in taxes and transfers. The top 1% of taxpayers pay, almost 73% of total taxes, and welfare transfers are now over 8% of GDP. So if you look at income after taxes and subsidies, the source suggests income inequality has actually decreased over the past decade.
So the argument is that looking purely at pre-tax income misses a big part of the picture.
Precisely. It really raises the question of whether we're always focusing on the most relevant metrics when we discuss inequality in India.
It certainly presents a very different perspective than the dominant one. So the takeaway seems to be, yes, challenges remain, particularly accessing quality health and education. But the data also points strongly towards significant progress and maybe rising aspirations for a huge number of people.
That sums it up well.
Okay, let's shift gears now, moving from broad economic trends to a very specific and quite sensitive issue, pilot mental health.
Yes, critical for safety.
Absolutely. Recent incidents like that Air India 787 issue in Ahmedabad, and thinking back to the awful Germanwings crash in 2015, they really bring this conversation back to the forefront. It's often seen as taboo in the aviation world, isn't it?
Very much so. And what's fascinating, or perhaps concerning, are the unique pressures pilots face. It's not just the job itself.
What kind of pressures?
Well, there's the physiological stuff, having to sleep to order in unfamiliar hotels, different time zones. It leads to chronic sleep debt. Then there's the constant roster changes, messing with work-life balance, family relationships.
Yeah, I can imagine that's tough.
Plus, add financial stress. Training costs are escalating, salaries sometimes stagnate, and on top of all that, there's this professional culture. A reluctance to admit any kind of human weakness, voluntary disclosure about mental health struggles. It often feels like career suicide to them.
So they hide it. The elephant in the room, as the article puts it.
Exactly, which is why the statistics are so alarming when researchers do manage to get anonymous data.
Right, let's get into that. There was a Harvard study mentioned.
Yes, the Harvard T.H. Chan School of Public Health study. It was a cross-sectional, anonymous survey of pilots.
And the findings?
Pretty sobering. 12.6% of the pilots surveyed met the threshold for likely depression.
Over 1 in 10.
And even more worrying, 4.1% admitted they'd had thoughts of suicide or self-harm within the previous 2 weeks.
4%. Wow.
Yeah.
That's deeply concerning, especially in that profession. So what does this mean for safety, and what can airlines actually do about it?
It means addressing mental health is fundamental to aviation safety, not just a nice-to-have. The focus really needs to shift from sort of punitive measures towards supportive ones.
Like what kind of support?
Things like policies allowing paid leave for major life events, divorce, bereavement, a sick child. Things that can temporarily destabilize anyone. Also, establishing really active peer support programs. Crucially, these need to be managed by pilots, for pilots, to build trust and remove that stigma.
Peer support. Okay. What about treatment? Can pilots fly if they're diagnosed with something?
That's a key point. The source advocates a pragmatic approach, allowing pilots diagnosed with certain conditions like depression to continue flying safely, provided they're on aviation-approved medication and undergo regular follow-ups.
So treat it like any other manageable medical condition.
Essentially, yes. The U.S. Federal Air Surgeon said back in 2022, early treatment is a win-win. Know about it, manage it. The FAA in the U.S. is even setting up a new committee specifically focused on mental health clearances. It poses the question, isn't it safer to know and monitor rather than potentially not knowing at all because pilots are too afraid to speak up?
That makes a lot of sense. Know and monitor rather than push it underground. So what about the regulators? India's DGCA, for instance, what should they be doing?
The source suggests they need to adopt a very progressive attitude. Specifically, it argues against requiring really detailed, rigid mental health tests as part of medicals.
Why not? Wouldn't that catch
Yeah.
problems?
The fear is it would be counterproductive. It could add more mental burden, lead to pilots trying to game the tests, resulting in misdiagnosis or more likely non-diagnosis because people hide things even more effectively.
Ah, I see. So what's the alternative?
Education. Training pilots, especially flight instructors who see trainees regularly, to recognize the signs of depression or distress in their colleagues. Fostering an environment where seeking help isn't penalized.
And maybe legal frameworks.
Yes, the article mentions the idea of legislation, like requiring healthcare providers to inform authorities if a patient's condition could impact public safety pilots, surgeons, etc., but with very strict safeguards for patient data privacy. It's about transparency and support leading to safety.
A pragmatic, supportive approach, rather than a purely punitive one. Okay, let's turn to our final deep dive now. This one comes from the Ground Zero section, and it's just heartbreaking. The Mujpur Gambhira Bridge collapsed in Gujarat.
Yes, a terrible tragedy.
20 people lost their lives, others injured, one still missing. The story highlights Sonalban Ramesh Pahiyar, who lost her husband, her son Naitik, who the article notes was born after years of prayers, and her daughter Vedika, plus other relatives. Just devastating.
Unimaginable loss for that family and others.
And the really gut-wrenching part. Residents had apparently been flagging concerns about this bridge's safety for years.
Yeah, that's a recurring theme in these situations, sadly. The bridge itself was about 4 decades old, over 800 meters long, 23 spans. It was a key route for locals, apparently helping bypass an expressway toll.
So heavily used.
Very likely. It collapsed around 7:40 in the morning. Sonalben described being trapped in her sinking car for 2 hours before rescue. The Vadodara district collector, Anil Damalia, actually acknowledged that residents had raised concerns previously with local officials.
He admitted they knew.
He confirmed concerns were raised, yes, and that some repair work had been done, and a proposal for a new bridge was even made after technical visits. It shows the awareness was there, but the action wasn't sufficient or timely.
Which brings us to this point. The warnings weren't just recent. The article says complaints go back as far as 2017. Opposition parties, local residents talking about cracks, the bridge shaking, calling for heavy vehicles to be banned.
Years of warnings.
Sonal's father-in-law, Rabjipai, is quoted saying, "They begged the government to repair the crumbling bridge, but the requests were ignored." Just tragic. Now, 4 roads and buildings department officials have been suspended.
Yes, pending a full inquiry. The initial probe pointed to failure in the pedestal and articulation, basically. Key structural supports at the base and the joints between spans.
So, a catastrophic structural failure. When warnings were so clear for so long, what does that tell us?
It points to systemic issues, doesn't it? There's even mention of an audio recording involving an R&B officer admitting that a private consultant's survey had also flagged concerns, and his own assessment was the bridge may not survive for long, but bureaucracy seemingly stalled any real action.
An officer admitted it might not last, and still,
Yeah.
nothing concrete happened.
That's what the source reports, yes. And this isn't an isolated incident in Gujarat, unfortunately. The article reminds us of the Morbi bridge collapse in 2022, 135 deaths there, and it lists at least 4 other bridge collapses or partial collapses since 2021 in districts like Tapi and Surendranagar.
So this is part of a pattern.
It appears so, which is why the opposition parties have been so scathing, calling it the price of BJP's 30-year misrule, talking about a hollow Gujarat model, a man-made disaster, even an act of fraud. Strong words.
It's very strong.
Yeah.
And the government's response now after this latest tragedy.
Well, they've launched a statewide survey of around 7,000 bridges. Based on that, 5 have been shut down immediately, 4 have had restrictions imposed, and 36 are listed for urgent repairs. And significantly, they've approved a new Euro 212 crore bridge to be built parallel to the one that collapsed.
So action's being taken now, but it feels reactive.
Exactly, which is captured perfectly by a quote from a district panchayat member, Harshad Singh Parmar. He basically asks, they have decided to construct a new bridge only after all these lives were lost. Will this government respond to people's concerns only after deaths occur?
It's a question that hangs heavy in the air, doesn't it? From challenging economic data to hidden mental health struggles and these tragic infrastructure failures, today's deep dive really underscores the need to look beneath the surface. It leaves you wondering what other critical issues are out there waiting for a closer look. Thank you for listening. If today's episode gave you something useful, consider following us on Spotify so you're the first to hear the next one. You can give suggestions by contacting on Twitter handle given in the episode description. We are always eager to hear what our listeners want to be informed about. We wish you a great day.